We'll go ahead and start. Thank you for coming to our February Global Public Health Grand Rounds. I am absolutely pleased today to introduce Dr. Kim Shoaf, who is one of our faculty members here, who is a recent return to Utah. And we are absolutely pleased to have her back, recently escaping UCLA.
That's what I did.
She has a vast experience of working on projects overseas, especially in South America. And we've asked her to speak specifically on the work that she's been doing recently with the World Cup. So I'll turn it over to Kim.
Okay. So about 3 years ago, I got a phone call at my office at UCLA asking me if I was interested in working with a couple of researchers in Brazil to look at preparedness, the preparedness efforts in the health sector in Brazil for both the World Cup and the upcoming Olympic Games. And I said, that's exactly what I said. I said, wait, you want me to come to Brazil? And they said, yeah. I said, at your expense? Yeah. I said, well, how could I say no? So just if any of you want to do international, sort of experiences, you need to make sure that your publications are being published in places where people in those countries are going to read them. So make sure that you publish in international journals if you want to do international experiences. And they're like, well, you're the only person we could find that seems to really have expertise in this area. I'm like, well, there's a lot of other people, but that's okay. I'm not going to tell you who they are, so I can come to Brazil. So I got to go to Brazil, and this is what you do when you go to Brazil. These are my daughters. You have to, when you go on these places, yes, you're going to do all of your nice research and all your work and all that, but you also have to make sure that you experience the local country that you're at. And so we went to, actually, the urban jungle right in Rio de Janeiro, and then went up to Pão de Açúcar up there. I will tell you, I do not speak Portuguese. It is very helpful to speak the language of the country that you're in. However, I speak French and Spanish, so Portuguese sort of, I could understand them. Sometimes they could understand me. But we got along just fine. So that's just my ticket for make sure that you experience some of the culture while you're there. This project is called Proyecto Prepara Brasil. And it was a project with two colleagues at the Center for Pharmaceutical Policies at the Sergio Aruca National School of Public Health at the Oswaldo Cruz Foundation in Brazil, in Rio de Janeiro. And both of these colleagues of mine are pharmacists. And it was fascinating to think about having pharmacists interested in looking at preparedness of the health sector for World Cup, and really not a whole lot of other people in the School of Public Health there interested in that. There were a couple of others that were doing some things, but it was these two that were really interested in looking at what was going on directly in the health sector. And initially they wanted to know about pharmaceutical services, and they were just going to focus on that. And I said, well, you can't really focus just on pharmaceutical services without looking at the bigger picture. So unless somebody else is looking at the bigger picture that you can tie your study into, can we look at a bigger picture? So we did. We looked at the entire health sector in Brazil. FIFA World Cup, I assume everybody in here knows what World Cup is. Okay. So FIFA World Cup, every 4 years, the world comes to a country. Those countries have about 8 years of opportunity to plan for that. They're nominated somewhere between 8 and 12 years out. So we know the next two will be in Russia and then in Qatar. So they have about 8 years at least to prepare for this. And Brazil, like most countries, had that opportunity, had about 8 years or so to start preparing for this. They made the decision that they would have these games at 12 host cities across the country. If any of you have been to Brazil before, there are about 2 of these cities that are what I would call industrialized, modern, first world cities. Many of the others are Developing, certainly developing cities, and some of them, like Manaus, is right smack dab in the middle of the jungle. So here in Rio de Janeiro and Sao Paulo, these are very urban, cities. The other areas are not so much. As they started looking at this, and if you look back at the history of World Cup, the past World Cup games have all been in industrialized nations. So, Korea, Japan, South Africa was probably the most, the least industrialized of the nations recently. And South Africa had some issues, but it was almost entirely in Cape Town and in Johannesburg. They really kept it in those major cities. But Brazil was going to showcase their entire country, and so they decided to have these games in all 12 of these areas. Gave me some reason to stop and think about whether or not that was a good idea. So this is just so you also have to make sure that if you're studying World Cup, you have to go to the World Cup games. This is Maracanã Stadium in Rio de Janeiro. All of the stadiums, and I have some other pictures, but all of these stadiums were barely completed just before the games started. They were either brand new stadiums or were remodeled. So Maracanã Stadium had originally seated 200,000 people. It was remodeled to have a capacity of only 70,000 because at 200,000, people died at games all the time. So there had been some changes that were made to try and accommodate that and to be able to control a little bit the safety and security issues. They built an incredible system of ramps for ingress and egress in and out of the stadium, which were really amazing that they were able to move people out of the stadium very quickly. So they did a lot of planning in terms of sort of that security. But there were a couple of things that they were really concerned about that they weren't able to do anything about. Brazil has had historically a policy for the last 20 years or so of no alcohol in the football stadiums. Budweiser, Anheuser-Busch, is a major sponsor of FIFA World Cup, and FIFA insisted that Brazil change that policy for the World Cup games and sell alcohol at the stadiums. So they did. My daughters say that this is the most watered-down beer they have ever tasted in their lives. And I think Brazil did that intentionally to try and keep the alcohol level and the amount of sort of rowdiness that went on to a minimum. And so, even though they sold beer, they were very prepared in some sense to be able to think about some of those things. So there were some things that were going on in terms of that preparedness. But what was happening in the health sector? So we proposed this a project to look at what was going on within the health sector in the 12 host cities. So what kinds of things were the hospitals and the clinics and the municipal health, public health services, what were they doing to prepare for World Cup? And so I will talk to you a little bit about the hospital interviews, some of the hospital surveys that we did. We did key informant interviews in the 12 cities. We selected, for each city, we selected one reference hospital plus 2 general hospitals. And I'll talk a little bit more about the reference hospitals in a minute. And for each of those, we interviewed the director of the hospital and a pharmacist. In addition to that, we also made contact with the local Secretariat of Health in the municipality, and we interviewed a pharmacist and somebody that the Secretary of Health at the municipality referred us to, either the secretary, him or herself, or their representative. And then we interviewed somebody from this municipality civil defense office when we were able to. There were some interesting things that most of the civil defense interviews resulted in things like, I have nothing to do with health. I don't know why you're asking me these questions. I have nothing to do with health. And so there was very little connection between civil defense and the Secretariat of Health and the hospitals in the cities. We ended up with 35 hospitals, 11 reference hospitals, and 24 general hospitals, both public and private hospitals. Initially, they had talked about only doing public hospitals because they're the university is part of the Ministry of Health, which means that they're part of the whole public health system. And they said, well, that's the ones we're responsible for. And I said, but do you really think that all those people that are coming from the rest of the world are only going to go to the public hospitals? I don't know about others, but I'm not going to one of the public hospitals. I'm going to the private hospital. So, we decided that we would interview both public and private hospitals. These are key informant interviews, so they're qualitative interviews. So while I have percentages here, we have to realize that we're not talking about anything that is statistically significant. They're key informant interviews. They're just representative of themselves. Okay. This was one of the diagrams. This is what we sort of tried to use as a model, is really looking at how should we be coordinating preparedness in the health sector. And this comes from the World Health Organization, and talking about the responsibility of different sectors, different parts of the health sector and other outside sectors in terms of health in an emergency response. And this outside circle are sectors outside of health, and then the large inner circle is the public health sector. In the public health sector, there are parts of that that are responsible for quarantine and isolation. Anybody here part of the measles investigation that we had going on here? There we go. Yeah. Quarantine and isolation. We had some quarantine going on here in the state of Utah early in January because of the measles outbreak that we had. So part of the public health sector is responsible for quarantine and isolation. There are parts of that are responsible for coordinating with hospitals, and part of that process, that's generally an epi unit that coordinates with hospitals, and they also will have much of the communicable disease control functions as well. So those two overlap quite a bit, the communicable disease control and the coordination with hospitals, because a lot of that is getting information to the hospitals, getting information from the hospitals about what's going on. We have risk communication that overlaps a tiny bit with communicable disease control. Often that's another sector that's altogether within public health that's responsible for risk communication. Hopefully they talk to the people who are responsible for disease control, but not always. And then we have command and control. And we have command and control across all levels. Sometimes you will see command and control within epidemiology, within those who work with communicable disease control. We don't like to see them have a separate command and control. We like to see them sitting in the bigger public health command and control section. But sometimes they like to think that they're totally separate and different. And as long as they communicate with the other, that's fine. I have had arguments with epidemiologists, indeed, in this state about that. And then public health, within public health, there is a command and control unit that will be responsible for coordinating all of the public health efforts and ensuring that that is coordinated and organized, and then communicate that and coordinate that with the command and control outside the public health sector. So with preferably civil defense, who would be coordinating the entire thing. This is what we use in disasters. We use the exact same type of scenario and the exact same type of planning for mass events. So whenever we're looking at mass population events, planned events like World Cup, we generally like to use those same systems that we use for disasters because we're looking at things that are sort of organized chaos. And I'll show you some pictures later on that will help you understand what I mean by organized chaos. So this is where we were working from. This is the frame we were working from. As we developed the questionnaire, we started looking at some of the things that we wanted to know about. And the first thing was, what kind of planning are the hospitals doing? How much planning are they actually engaging in? And how much are they coordinating with government officials? You know, with the Secretary of Health, with the Ministry of Health, with the Civil Defense. And so this is response from these 35 hospitals. Yes, you do see that that bottom one, that farthest left, is 0. 13 of the 35 hospitals, more than 1/3 of them, had contact with 0 government agencies in planning for the World Cup. And then we had a couple, 4 I think, that actually had talked with 3 different agencies.
So did they have informal connections? Or were they just sort of out there?
They were just sort of out there flapping in the wind.
Wow.
They really, and when they had 0, they did 0 planning. And they connected not at all with government to prepare. They thought that this was going to be business as usual.
And this was how many months?
Oh, this was 2 to 3 months before World Cup started. So we're not talking about years in advance. We're talking about 2 to 3 months before the beginning of the games. Okay, so little different from the way Utah prepared for the Olympics, right, Dr. Alder? Just a little different. So what kinds of plans, what did they do? So the next question was communication. In every single disaster, every single emergency, the number one failure is communication. And the number one thing that makes you succeed is communication. And so when we look at this, we wanted to know about what are their communication plans. Indeed, 53% of hospitals had no specific, either did not know what their communication plans were. These are the directors of the hospitals. Either did not know what their communication plans were, or had no specific communication plans. More than half of them. Now, I'm a little impressed that 26% of them, so this 20% here, and this 6% here, said that they had their communication plans were that they would communicate with the Secretary of Health at the municipal level, and that would be their entree then to other communication. That's the way we want it to be. We want hospitals to communicate with public health, and then public health can communicate with the other sectors. 9% of them said they were going to go just to that communicable disease unit within public health. We know that oftentimes when things go in there, they don't go anyplace else. So that's only communicable disease. One of the things that, as we started talking with people, we realized that people were only thinking about the kinds of things that would happen were people would get traveler's diarrhea because they wouldn't wash their hands or they would eat something bad. That was sort of the extent of their thought process for what people would experience. That was certainly where the Ministry of Health was thinking. They were thinking water, sanitation, food safety, food security. That's what they were thinking. The hospitals did think a little bit more about the possibility of bioterrorism. And so there was some infectious disease thought process, but not a whole lot, and they didn't really understand exactly what that could possibly entail in terms of magnitude of an event. I will tell you that one of the reasons why people kept telling me that nobody was planning for any of this is because God is Brazilian, and so nothing bad can happen to Brazil. They say the Pope may be Argentinian, but God is Brazilian. So nothing bad could possibly happen in Brazil. And it is, well, that's sort of a joke. It is the mentality that nothing bad will ever happen. And people would say to me, I'd say, well, what about terrorism? But everybody loves Brazil. Who would do anything bad to Brazil? And I said, but the entire world is coming to Brazil, and everybody doesn't love the entire world. But it was not within their mental map to be able to think about something really bad happening while the world was in Brazil. About 6% said that they were going to just use their existing surveillance protocols. So their normal reportable diseases, that was how they were going to communicate, that just those existing protocols. So again, no thought process that anything out of the ordinary could happen. So we pushed them a little bit and asked them, well, what happens if we have a large infectious disease emergency where we have lots of patients who are infected with something transmissible? Do you have any plans to be able to surge your infectious disease isolation protocols? So 43% had no plans, and they had no existing space for isolation, infectious disease isolation, and they had no plans to do anything about it. 43% of the hospitals that we talked to. Okay. The other 57% had some plans. However, 37% of them had actual plans for isolation. Either they had existing isolation units and they knew how they could, add extra beds, or they knew how they could convert existing patient care units to isolation units. They talked about things like cohorting of similar symptoms, and they had actual plans for isolation. 14% of them said that they would refer them to the referral hospitals. So anybody who needed isolation, they would just send to the referral hospital, right? That's like we're sending all the Ebola patients to the Ebola hospitals, right? But what happens when the Ebola patient shows up in your hospital? You still have to take care of them until you can get them to the referral hospital. How do you do that? So they had no plans for dealing with it other than sending them to the referral hospitals. 6 months before World Cup, there was one referral hospital in each municipality. One. And somebody pointed out to the Ministry of Health that maybe that wasn't such a good idea, that maybe they needed a few more. And so they started adding referral hospitals. By adding referral hospitals, I mean they basically said, you're a referral hospital, and you're a referral hospital, and you're a referral hospital. There was no need for any specific plans. As a matter of fact, some of these who said that they had no plans were referral hospitals. Just, And this is my favorite, these two who said they were going to figure it out just in time. If something happened, they would figure it out on the spot. It's my favorite kind of disaster planning, which is, if something bad happens, I'll figure it out then. So, I want to talk to you a little bit about where this planning was. They had 8 years to plan for this stuff. 8 years. The stadiums weren't done. When I went back this last time in December after World Cup, the airport was almost done in Rio. During the games, one of the stadiums, one of the cities and one of the host cities in the south of Brazil had no terminal at the airport. People landed on the tarmac, came out under a tent, and went through immigration in a tent because they had no airport. Okay. They dubbed referral hospitals. They didn't do a whole lot of planning. And yet, nothing bad happened except for the fact that Brazil lost. That to them was their biggest disaster. What does that mean for the Olympics coming up in 2016? For World Cup, there were about 30 million visitors across the country. They're expecting 3 million visitors across the country. They are expecting 30 million visitors in Rio de Janeiro for the Olympics. The Olympics are less than 18 months away. None of the Olympic venues are done. The Olympic venues will primarily be out in the area called Baja de Tijuca, which is an area outside, it's sort of the new modern urban area outside of traditional urban Rio. They've got these gorgeous American-style malls and McDonald's, which is why they're putting the Olympics out there, because they are building hotels. Not a whole lot of hotel rooms out there. There's some being built. There are 3 hospitals in Baja de Tijuca. 3. In normal Rio traffic, it takes about an hour to get from Baja to Rio. Something happens out there, 10 million people visiting the games. There is no access to health care out there. 0. Nothing happened during World Cup, so nothing's going to happen during the Olympics either. The thought process, the mentality of something bad could happen, therefore I need to do something to be ready for that, just does not exist in this culture. So these are the stadiums. As I said, there's 60,000, somewhere between 40 and 70, 80,000 people. Even if one of these stadiums collapsed, you are looking at least 10 times the capacity of the local healthcare systems. The stadiums are one thing. They have these big fan fests. If anybody's ever been to World Cup, they have these fan fests. They actually have them all around the world. Fan fests in country are amazing. These are my daughters hanging out with a million other expats on Copacabana Beach the night of one of the USA games. That doesn't look so bad, right? This is what it looked like going into FanFest. There are no healthcare services at FanFest. There's no water stations where they're just giving out water. It is 85 degrees and 95% humidity. There's no water stations. There's no first aid station. I walked into FanFest, and there was shortly after I got into FanFest, there was this little booth on the right-hand side from Mexico. It was Mexico's booth. And they had these little puff seats and free Wi-Fi access and foosball. And I sat down and said, guys, have fun. I'm sitting here. Come collect me on your way back out, because I'm not going through that. I mean, it's just craziness. Just to see a little different perspective on that, if that one's not bad enough, that's the aerial perspective of Copacabana Beach, FanFest at Copacabana Beach. Those are not ants. Those are people. Those are people. So this is FanFest. That up on the upper left-hand corner is the ocean. That's the beach. So it is just wall-to-wall humanity from the ocean to the street. Wall-to-wall. There was minimal security getting in there. There were no bomb-sniffing dogs. There were no people walking, no security walking through FanFest. What happens if a bomb went off in the middle of that? The bomb would do less damage than the carnage by people stomping all over each other to get away from it. It could be a very tiny little bomb. No thought process whatsoever. So what do? How do you get people to think about the possibility of something bad happening? They had stadium collapses. They fixed that by building new stadiums. It was not going to happen. I mean, it was really, we cut down the size of Maracanã so that we wouldn't have to worry about people stomping all over each other.
So these things become such an issue of national pride.
Mm-hmm.
And I think practicality has very little to do with the emotion that goes into an event of national pride. How could any good examples of countries at this level of development would have been able to have a health infrastructure to manage that surge of crowds certainly would be costly. Are there countries that have managed well to be able to do temporary solutions that have been cost effective?
The only country that is similar level of development, it would be South Africa, which is actually, I mean, you know, it's a high moderate income country. However, like I said, they were in their major cities, so they had a better level of infrastructure, you know, in those cities where the games happened. And they did a lot of planning. They brought in experts from CDC. They brought in experts from the World Association of Disaster and Emergency Medicine to work with them. There are people there in South Africa that are part of the World Association of Disaster and Emergency Medicine. They have a strong EMS system in South Africa. They have a trauma system in South Africa. They have systems that are already in fairly good shape. Brazil has no EMS system, no emergency medical services. They have no trauma system. They have just begun in the last 5 years a specialty in emergency medicine. So they do not have hospitals with trained emergency physicians providing emergency care.
I compare that to our experience with the Salt Lake City Olympics. And I imagine we were using the same sort of mentality, I think, here, that, you know, it's the Olympics, everybody comes together, it's fine. Well,
unfortunately, September 11th happened just before that.
You know, we can split our preparation as pre-September 11th, 2001 and post-September 11th, 2001. And let me tell you, teams got really serious on September 11th, and all of a sudden, you know, we were playing for real at that point. Where before, it was, many people were saying, you know, the likelihood that anything is going to happen is so low. Let's use this as an excuse to boost some of our infrastructure. And, but it took a complete, you know, we were in pretty good denial. And boy, when we saw what could happen, I mean, I think, I don't know, how old were you all on September 11th?
6,
10.
I
mean, you know, it was for being an adult, it was sort of, the world changed at that moment. And I think we recognized a vulnerability we thought we didn't have. And all of a sudden, when we started looking at our Olympic preparation, the context of that vulnerability and recognizing that, and then, you know, it was not only September 11th, but then there were the anthrax attacks right after that, realizing that, in fact, you could easily distribute a bioterrorism agent in a crowded venue and cause all sorts of trouble very, very, unfortunately, very easily. And we had the luxury that the crowd that the Winter Olympics generated was relatively easily absorbed by the Salt Lake metropolitan area. And things went smoothly, although we had some scares along the way that fortunately we were able to respond to very quickly and take care of that most people didn't even realize. There were two specific events. One event was the BioFire. If you see the sign, you know BioFire. They actually had some of their sensors, and one of them went off at the airport. And they had to decide: do we shut the place down, or do we do a second test because we think this was a false alarm? And they were able to go through a process and say, you know, the likelihood that this is real is so low. We'll still confirm, but we think it's not a problem. The second major thing was we had started syndromic surveillance on where we had all of our hospitals and emergency departments and even clinics reporting daily what sorts of things were showing up, and there was a lot of GI distress, which was actually one of the warning signs for a bioterrorism agent. And we had actually just implemented an electronic health record. Now those seem like they're all over the place. amazingly, only 14 years ago in 2001 and 13 years ago in 2002, those were pretty new. And we had just implemented ours at the university and set up a system where we could monitor, and when that alert went off, we were able to show really quickly, because we had electronic health record, that culture-confirmed influenza that year, for some reason, had a GI component to it, which is actually incredibly atypical for actual influenza. So we were able to, fortunately, with our infrastructure, it was mostly in place and a little enhancement. But I think recognizing when you see a situation like this, the vulnerability is immense, and there are a lot of people, it turns out, who would like to make a statement on the world
Absolutely.
stage, regardless of where that world stage happens to be.
Absolutely.
Yeah, related to that idea you're talking about risk perception in the public, I would actually say that before 9/11, the number of terror attacks we had were greater here and across the world. I mean, no one ever thinks of the Oklahoma City bombing. Other fact, I believe the World Trade Center was attacked prior to that, actually. The U.S. is cold, and not to mention all the IRA attacks that happened in the United Kingdom, which aren't there anymore. So I think that there was, and by the way, I just want to say I squarely blame both political parties for dropping the ball on that. I think Bill Clinton and George Bush's handling were outrageous on those things. But having said that, I think even after 9/11, people had this idea of, oh, this could only happen to the U.S., or oh, this could only happen during the Olympics. On 7/7/2005, the United Kingdom got bombed in its subway system the day after it was announced that the Olympics were gone. But that was also the day that the G8 was in the United Kingdom. And so there was also this idea of, again, someone just drawing out tons of attention to themselves. So I agree with you. I know I'm not really... I'm just saying that with the public, there seems to be this real risk perception.
Right, and it is. It's interesting because the risk perception is...
And it's like the political leaders want to follow that, not lead with that.
Absolutely, and there's a lot of that, and there was a lot of this in Brazil as well. And there's also sort of a bifurcated mentality. So the military in Brazil brought in the U.S. Department of Homeland Security Anti-Terrorism Task Force and worked with them in terms of getting the military ready to respond if something happened. That never crossed over to any of the other sectors. The military is going to deal with this. We're going to handle it. And we don't have to worry about anybody else. And that's not unlike some of what's happened in the U.S. I mean, interestingly, while people outside of the disaster preparedness world think pre-9/11, post-9/11, we actually started a lot of the work in the 1990s. So public health even started working. The fact that there was a syndromic surveillance system was because in the 1990s there was a limited amount of money given to some states to get public health started. There was a recognition that public health was needed by the Clinton administration that actually saw that coming, saw the writing on the wall, and brought that in. And then that sort of became ramped up very quickly on September 11th. So those of us who were already working in the field before September 11th was sort of like yep, we knew it was coming, there it is. So there is some of that. And there's some issues with public health. I will tell you that, I started in 1998 doing training in public health about disaster preparedness, not just terrorism, but disasters in general, and about how public health needed to come to the table with everybody else. And I said, no, not going to happen. In 1998, we wrote a white paper for the California Department of Public Health that said, public health needs to move into the age of disaster preparedness and response, sit at the table, and learn to use the incident command system. And we were told it would be a cold day in hell before public health would ever use ICS. So 6 years later, when I sat in the Department of Public Health's beautiful brand new Departmental Operations System Center with all of their instant command structure set up there, I said, so I guess hell froze over? Is that what happened? Because I'm sitting here and looking at this. So there is, it takes something to move people. we are now at a point where the funding for public health in this country for disaster preparedness and response is at somewhere between between 30 and 50% of what it was at the peak. Are our needs any less? No. But we have somewhere about maybe a third to a half of what we had had at the peak of funding. So when we think about global public health, we have to include us in that globe, right? It's not just what happens in less developed nations. And, we have some of those same issues.
So, just to give a recent example, if you look at the Super Bowl, the amount of preparedness was dramatic. Mm-hmm. And that was really driven by two things. The NFL not wanting to look bad, and the insurance companies that mandate certain protections around the activity. It's an economic model that drives emergency preparedness here, now. It's an economic publicity.
At large events.
Yeah,
For large events. For large events. Yes. But at the same time, so they started off and they had all this stuff, and then we had a measles outbreak. And Public Health, the Arizona Department of Public Health said, we got to do something about it. And they basically told people, if you haven't been vaccinated, don't come to Arizona. Don't come to the Super Bowl. Don't come. If you've not been vaccinated for measles, we don't want you here. Don't come. Now, I don't know how that went over with the NFL, but the Arizona Department of Public Health was pretty adamant about that.
I just got back from spending a month in Sao Paulo and a month in Cape Town right before that, and I was doing, global public health study abroad, and I found it very difficult to really find much information about this topic. So it's super interesting. Thank you. But in both places, we learned a lot about large populations displaced for not only building the stadiums, but the infrastructure around the stadiums, like storefronts or metro lines. And in Brazil, especially, the favelas grew by millions and millions of people. And I was wondering if you ever heard any dialogue with the Secretary of Health or the Ministry of Health and possible huge influx of people seeking medical attention for outbreaks of disease in those permanent informal housing?
Well, permanent informal housing, because the favelas are pretty permanent. And they're pretty proud of the fact that they're pretty permanent. There wasn't a whole lot of that. It was sort of that's just, the clinics that are around there are going to take care of it, and they're fine, and everything's just sort of. There was really very little in terms of either what was going to happen with the domestic population as a result of people bringing diseases in, and, one of my fears was that, somebody would come in from Africa who had dengue, had a different form of dengue, and get dengue in Brazil, and then all of a sudden we would start to see, hemorrhagic dengue cases. There were all kinds, and there was very little thought process about what people are bringing in or what's happening to our population as a result. The population themselves were in an uproar because the government, as much as they want to say that it's not the government and that in the long run the government makes money, there is some money to be made from World Cup. There's a lot of people come and spend tourism dollars, and a lot of money is spent. I'm not sure that it always offsets the amount of money that is spent to make the country look good. It wasn't even necessarily infrastructure programs that were going to have long-term benefit to the population, or were done in time for World Cup to happen. But, a lot of things just to make it look good. And so the public, there were riots in the streets on a daily basis in Rio for the months leading up to World Cup.
So after all the preparation, did you think they were prepared? If I randomly dropped a couple people with Ebola into that crowd or drinking yours?
Heavens to Betsy, no.
Okay.
It wouldn't even have to be Ebola. Just if there was an uptick in dengue cases. Chikungunya. You know, a severe rainstorm. I mean, it rained horrendously in Recife during the World Cup, and they had, you know, there was water up to their people's waists, and there was no response mechanism in place.
I just had a question about kind of funding and oversight. Does FIFA or like the Olympics provide any, like, they're going to host, you know, World Cup or Olympics, or do they have any sort of like, we have these standards for the countries that we want to host FIFA World Cup? They just say that's it, and you're on your own.
Yeah, it pretty much. And if you look at, I mean, if you look at the Winter Olympics in Russia, I mean, it tells you that there really are no standards in terms of what needs to be in place in a location in order to host these games. I mean, or FIFA and Qatar. Right now, there's a whole big there's a big political brouhaha over having World Cup in Qatar because workers building the stadiums are dying by the tens and hundreds because of the heat. Yeah. But so, you know, FIFA's sort of getting a little bit of a black eye for, you know, why are we doing it there? It's not even a football country. It's not, you know, nobody plays football in Qatar.
FIFA's known for being quite corrupt around the world.
Really? Yeah. So, yeah. And so is the International Olympic Committee, you know, when you come right down to it. So there's, you know, indeed, not only does FIFA or the Olympic Committee not give any money to the host nations, there's actually a lot of money exchanged and goods exchanged with FIFA and Olympic officials. So.
Why host?
Because it.
Nationalism.
Nationalism, national pride. It really is. It's about national pride. It's about showcasing. Salt Lake is the only Winter Olympics, I think, in modern history that has actually made money.
Yeah, I could actually tell you that. I live from the city of Chicago, and Mayor Daley is a really big name. He was leaving office as mayor. All he ever wanted to do was be mayor. He really wanted to have the Olympics there back in 2008, I believe. And to him, just being able to say that was his legacy was a really big deal for him.
Yeah. Yeah, it's a huge deal, and it's, you know, and places fight over it. And, you know, the fact that they award these bids to these places that are just not anywhere near capable of handling this. And, you know, why do they need to do anything more? Nothing happened to World Cup. Everything was fine. Dr. Giesiger.
So what about the fact that the favelas are run by drug lords and they have issues, and, you know, Rio and the other cities that have these favelas deal with that on a regular basis, and as they've had the World Cup and now the Olympics, talk about what's playing out with that and how they're trying to handle that.
Well, the favelas are an interesting story in Brazil because if you've traveled at all in Latin America, there are these informal cities everywhere. In Peru, they're called Pueblo Jóvenes. So these informal cities grow up everywhere in Latin America, and part of it has to do with the fact that they have really liberal homesteading laws in these countries that allow that if you occupy a land, it becomes your land, and so that, you know, if you can't afford to buy property, you basically appropriate it. So they have very liberal homesteading laws. They also have very interesting tax laws that as long as the building's not finished, most of these countries, as long as the building's not finished, you don't pay any property taxes on the building. And so they never finish the buildings because then they don't have to pay property taxes, which then means that there's not money to pay for services for the population. But that's, you know, that's sort of lost on people, and not just in Latin America, but in all the world. You know, why should I have to pay taxes, right? And so in most of these other places, eventually those Pueblo Jóvenes, those little villages, eventually become formal settlements. And they eventually get municipal services, and they get schools, and they get all the roads, and they get all these other things. And they become part of just the society. That does not occur in Brazil. The favelas are actually a point of Brazilian pride. It is a point of Brazilian pride. I came from the favela, and I still live in the favela, and I am a success. Now, the percentage of success stories coming out of the favelas is pretty low. Because you also have, they're sort of informal, they're not part of the metropolitan area, and so there's some issues with the policing. And so you have police in there, and then you've got drug lords, and the police and the drug lords shoot it out on the streets. Not unlike what happens in South Central Los Angeles in the gang wars. Very similar. People would say to me, "Oh, it's not safe in Rio." And I'm like, I live in Los Angeles. Seriously, you're telling me that Rio's not safe? Oh, but it's not the same. Oh, yeah, it is. There are drug deals going down in the corner by my daughter's high school all the time. And it's not, it's not anything different. But the issue is that, like in South Central Los Angeles, the police eventually pull out because they're tired of being killed. And so the police pulled out, and the drug lords basically ruled the favelas. Well, then the world was coming to Brazil, and they couldn't have the drug lords ruling favelas because the favelas are also a tourism spot. You can actually take a tour of the favelas. And so they had to do something. And so they put the military police into the favelas to clean up the favelas months before the games started. Not years before. Not working with the people in the favelas to do something. But they brought the military police in. Well, that just increased the amount of violence that was going on in the favelas. Because it's, you can't come in here and tell us what to do. This is our favela. We rule here. We're in charge. So there were a lot of, and then the police killed a guy, this famous musician from one of the favelas. And so then the entire population was up in arms because the police were just randomly killing people on the streets. There's two sides to every story. And there's two sides to that story. I don't know what the sides are, but there are multiple sides to those stories. So there's a lot going on. And all that in the backstage of everything's fine, everything's happy, God is Brazilian, all will be well. What are they doing now for the Olympics? Are they the same? We are looking at whether or not we can get some additional funding to go back. We've actually taken some of the work that we've done and sort of assuming that what we learned from these hospitals was true, started modeling for the Olympics in Rio. So just looking at within Rio and mapping out the hospitals and what the distances are and what capacity those different hospitals have. If you ever want to get depressed, some of these analyses are actually pretty depressing about, if something were to happen. I mean, hopefully nothing will happen. But as the FEMA signs say, those posters, hope is not a plan. Unless you're Brazilian.
You talked about how they're starting to build this structure and emergency medicine is now becoming like a training point for Brazilian doctors. Would you say that would be like the most effective kind of like long-term plan?
Yeah. I think long-term, when we start looking at, there are certainly people within civil defense that are looking at U.S. and European models of what's going on. They are now, like I said, they're now starting emergency medicine. Hopefully, they will look at the successes and learn from what has happened in both other Latin American countries that have similar infrastructure to them, as well as what's happening in the U.S. and Europe. One of my concerns is that they are. That the nationalistic pride is actually not going to allow them to follow the models that have worked in other countries. So, for example, their plans for for emergency medicine for hospitals. So do you know anything about the trauma systems here in the U.S.? So in the United States, we have a trauma system, and that trauma, I mean, they've got it in Canada and they've got other places. Mexico actually has adopted a trauma system, and there are a number of Latin American countries that are in the process of building a trauma system, which is a system where you have classifications of hospitals that are capable of taking care of traumatic injuries, so major injuries. And the idea is that you identify trauma patients in the field. So EMS is trained to identify trauma patients in the field and transport those at the highest severity levels directly to a trauma center that is able to provide them definitive surgical care and treatment immediately. Prior to the trauma system, people would be transported to the nearest emergency department. They'd be stabilized, and then if they were bad enough, they'd be transferred someplace else. Analysis of those systems, there was a, I think it was in Montreal, Canada, was one of the last provinces, one of the last places to actually institute the trauma system. And they actually decided very proactively that they were going to do some real evaluation and look at what their injury mortality rates were, what their case fatality rates were for injuries before and after they instituted the system. And they found a 400% decrease in case fatalities in severe injuries after they instituted the trauma system. Brazil's plan is to create these little community emergency systems where they would take all of everybody who's injured in whatever type of motor vehicle, mostly motor vehicle accidents, and bring them to these community centers, these community emergency centers, were really not much more than urgent care facilities. Do an assessment of them, keep them there, stabilize them, and if within 24 to 48 hours they determine that they can't do what they need for them, then to transfer them to an orthopedic trauma hospital, which is the exact opposite of what the trauma system is. Because if they're not in definitive care within hours, if not minutes preferably, of being injured, the likelihood of mortality increases exponentially. But they're saying, well, we're going to do this. Doesn't matter what all the data shows in other countries. This is the way we're going to do it because this is Brazilian. And for me, it's very hard for me to talk about another country that way and talk about culturally, because it's always every culture has their own right to determine what's best for them. But within Brazil, people are saying this just doesn't make sense. Why are we doing this? This is just a matter of national pride. It's sticking our fingers in the eye of science. Why are we doing this? So it's disheartening when you hear people defending, oh, we have emergency medicine. No, you have emergency rooms where any doctor who happens to be available is on call. And usually it's a third-year resident, who, by the way, is 23 years old at most, because they go straight from high school into medical school, 5 years, and they're done. So, thank you.